The two items that we wanted to cover on the program real quick. One is the N of 1 trials. And again, I'll get a lot of haters on this too. It's information that needs to go out there. These people did a series of experiments with people regarding statins, side effects of statins. So here's what they did. James Howard presented SAMSON N of 1 trial at an American Heart Association meeting. Patients really do suffer from statin side effects. Symptoms are not caused by the statin molecules, sometimes just by the act of taking a tablet. We're not saying, before you get upset, let's just read the rest of it. They're almost as bad as if they're taking a placebo. How's the SAMSON trial performed? They took 60 patients who had previously taken a statin and stopped due to intolerable side effects. 4 bottles of 20 milligram atorvastatin, Lipitor, 4 bottles of placebo, and 4 empty bottles every month. And I would say I don't use Lipitor and I don't use 20 milligrams Lipitor. So for several reasons, which we can talk about later if anybody has a question. Every month in random order, patients were told which bottle to take. Daily symptom check-ins were given on a smartphone. Bad symptoms were rated from 0 to 100. And you see here where those symptoms were listed. After 1 year, researchers showed patients whether their symptoms were worse with statins or placebo. 6 months later, researchers asked the subjects if they went back to the statin after their discussion. Here was the results. When subjects took nothing, they actually had very minimal symptoms. But when they took a placebo, it was 90% as bad as the symptoms of taking a statin. There were 71 instances where patients stopped taking the tablets because of bad symptoms, but only 40 of those 71 were they taking the statin. The rest were taking the placebo. After showing the patients the results after 1 year, 30 of 60 patients went back to take statins 6 months later. So here's a couple of explanations. One is the nocebo effect. Statins are making people feel worse because they're expecting it. With periods of statins, placebo, and no treatment, researchers were able to show that the nocebo effect is really powerful. It does exist in the statin arena. Now, maybe the tablets were not doing anything, but at their age, patients do have arthritis, they have aches, they have pains. You know, we're baby boomers. We have challenges. And maybe they blame some of those symptoms on that. Now, here's some arguments about it. While elegantly done, SAMSON didn't use a washout period between treatments. This might have biased the findings. What that means is, especially with some of the statins like Lipitor, you really should wait a week to make sure that there's still no statin left in the system before you attribute no symptoms. And that's a very accurate point. Dr. Salim Virani, ACC Prevention of Cardiovascular Disease Council Chair, said that SAMSON shouldn't make doctors dismissive of statin-related muscle or other symptom complaints. I would agree with Dr. Virani. Can't help but go off script just a second and add some of my own comments. As I've mentioned before, I don't use Lipitor. I don't use high-dose statins. I don't use statins for LDL. I use usually either low-dose rosuvastatin, Crestor, or low-dose pitavastatin, Livalo. And that's for cardiovascular inflammation. It's not for lowering LDL. These higher dose statins do tend to have problems. Now, you'll hear a couple of comments about that a little bit later as well. Doctors need to take complaints head on. The usual strategy of finding a different statin is reasonable. Another editorial comment I have to add. If you go back and you look at Framingham, we've talked about that multiple times. Framingham is the set of questions that the doctor asks usually before they'll start you on a statin. They know how old you are, they know what gender you are, they know whether you've smoked or not, look at your LDL and decide whether or not they want to put you on statins. Framingham is the town in Massachusetts near Harvard where they developed all of these formula for this. The formula overestimate the probability of risk. Therefore, as in a factor of 2, especially for women, therefore, any of the statin recommendations based on Framingham are likely to be twice as likely to put you on a statin as you may really need. So there's a whole bunch of problems behind statins. Anyhow, I'll read the last comment and then we'll move on. Howard argued that starting patients at a low dose and increasing the dose may send the message that side effects are to be expected at a certain dose. So that gets into a whole debate, which I think is actually valid. I would take the other side of that and say that a level of statins does make a difference. Dosage does. Why wait for a disease and hope for a cure? I used to be an ER doc. My name is Ford Brewer. I quit ER after a few years because it was just so frustrating. Most of the things bringing people into the ER are things that should have been prevented, including heart attack, stroke, #1 cause of death, #1 cause of permanent disability. People think that you're just going to have those and that they're not predictable. Both of those are wrong. They are predictable and you don't have to have them. Usually it's lifestyle. Lifestyle is more important than supplements and even prescription drugs and even stents and surgery. But the current times are tough. Major financial impact with the lockdowns that most states have been going through. We've been working on a way to make this much more affordable with a subscription process. And that's exactly what we're announcing today. We've got 2 levels. One is the Silver membership, where you get access to our courses, a private webinar each month, and access to our supplement store and supplement recommendations and prescription. Or I would suggest even more so, the Gold membership. You can get a script for a Freestyle Libre and find out what your blood sugar metabolism's doing on a daily basis. And you can get a lab order for inflammation, OGTT, and insulin survey. You can also get a 30-minute one-on-one with me. So I'm looking forward to seeing you. Cost is no longer an excuse. So if you're interested, go to go.prevmedheartrisk.com/prevmed-subscription or call us at 859-721-1414, 859-721-1414, or email us at myhealth@prevmedheartrisk.com. Looking forward to seeing you. Thank you.